Greetings. Welcome to Lesson 2. My name is Deidre Sully. I'm a public health professional with almost 20 years in the field. I've done research, tobacco control, policy, and advocacy. And as I said last time, it's really important to pay it forward. So without further ado, let's get into Lesson 2 of this public health or Masters of Public Health free study course. And Lesson 2 is Principles and Core Services. So, what are our learning objectives? What do we want to walk away with? Well, we're going to make sure that you can describe the core public health disciplines, define basic public health terminology, understand the 10 essential public health services, and maybe identify some achievements in public health. In this lesson, here's what we're going to go over in order: the terminology and concepts. There are several terms to pay attention to throughout the course, and during each lesson, we're going to highlight several, which will be defined as we move through the course. We may get to more than just what you see, but those are the ones that are most relevant to this lesson. We're going to talk about the core public health disciplines or knowledge areas. We're going to do an overview of 10 essential public health services and a knowledge check. We always have to see how much you retained, right? So what are the terminology and concepts you want to pay attention to for this lesson? So there are social determinants. Sometimes we say social determinants of health, evaluation, health equity, health outcomes, policy, and promotion. There are others that we'll hear throughout the course, and you'll have access to the glossary of terms per lesson on my website. So I want to get into the public health disciplines, and this may vary by school, but for the most part, the core public health disciplines are usually uniform and consistent, depending throughout public health programs in different institutions. And so they are epidemiology, biostatistics, health policy and management, health law, social and behavioral health, and environmental health. And some schools even offer separately maternal and child health or global health. But generally, these are what you'll see in different public health programs, and they're all very important and they are all interrelated. So, epidemiology. What is it? By definition, it's the study of the distribution and determinants of health-related states and events in specified populations. It's a foundation for public health surveillance. It looks at disease patterns and trends within populations, making recommendations for courses of action or course correction to address illness. Some crucial skills that you need to have, or crucial skills that you learn, is analyzing and assessing data. So these are people who, count who determine incidence and prevalence. So when it comes to like figuring out how many people are smoking in a city, so what's the rate of smokers, in the adult population? What's the rate of smokers in the youth population? And being able to put across surveys to find that out, annual or biannual health behavior surveys to find that out. A lot of that is epidemiology. It also moves into biostatistics, which is our next one. That's also a foundational discipline in public health. It describes and analyzes and interprets health data that's applied to biological health and medical sciences. It's a branch of statistics that deals with collecting biological public health data. You got it, like numbers and analyzing and assessing data, excuse me. Many times, epidemiology and biostatistics are paired together. So you'll hear terms like epibio, right? Because they do go hand in hand. Another area, health law. So what is it? The study of the legislative process and application of the law to public health systems and activities. It's also creating laws based in public health. Crucial skills, policy development. You have to be able to understand codes, laws and codes. Public speaking is very key. We see a lot of the health law and it's applied when it comes to things like, health insurance and coverage, federal, state, and local legislation with regards to enacting policies such as seatbelt laws, right? Advocacy. policy and regulation. So not everything is going to be codified, but they may be regulations that's set down by an agency, right? So that goes into health law. Related to it is health policy and management. It is encompassing of both health policy and health legislation. It's multidisciplinary. Um, and it also aims to improve the quality, cost, and delivery of healthcare. The purpose is used to, let's remember, we go back to our three P's from our first lesson: prevent disease, promote health, and prolong life. Health policy can have, and health policy and management rather, can have a major impact on health and well-being. So the next is our social and behavioral area. It's studying individuals and how they relate to their surrounding community, analyzing social determinants of health. We said that word before when we talked about epidemiology. So, social determinants, right, or social determinants of health was one of our terms. And what is it? It is the environmental factors that affect where we live, work, and play, worship, where we learn, all of those things. So social and behavioral health also encompasses um, analyzing those social determinants of health and other risk factors, and then determining the appropriate interventions. You know, program planning, communications, cultural competency, and counseling are all crucial skills that go into social and behavioral health. It's actually a really large part of community health, right? That grassroots movement that we talked about during our first lesson. And then finally, we have environmental health. It focuses on the relationships between people and their environment. So, you know, it actually goes back, it pulls back to epidemiology and biostatistics because it involves research, chemistry, advocacy. You know, we have many different groups, as we talked about in the first lesson, where environment and studying how the pesticides and things that we use affect our health, and they leak over into the health of humans when we're trying to, you know, cultivate crops and keep bugs and things from crawling on the lettuce, you know, if you will. But those things can affect not only the environment, you know, meaning the flora and the fauna around it, but it can also leak into our own health because of how we distribute and ingest food. So those are the several public health disciplines. As I said, they can vary depending on what school you're in, but these are very, very crucial to masters in public health and crucial to how the field is worked in, how we move throughout the field, because these are the areas that are very crucial. As I said, there's also maternal and child health. You know, some schools do have that as a separate group, but these are usually the ones that you'll see and that are, you know, remain consistent. So one thing that I wanted to get into are the essential public health services, or 10 essential public health services. And this is really developed and laid out by the CDC. And the 10 essential public health services are actually divided into three core areas: assessment, and that's information gathering, grasping the magnitude or value or nature of a thing, or being able to estimate the nature of a thing. Policy development, creating pathways to direct behavior. What is development? It's to create or build something. Policies are rules and codes that guide our actions and eventually thoughts sometimes. Assurance is dispelling doubt or guaranteeing positive results or certainty. So the first two areas, or first two public health services fall under assessment. So the first one is monitoring health status to identify and solve community health problems. We have to be vigilant to the current health of individuals, using data and information to determine root causes of things. You have to work with the communities to actually understand the issues. Number two, diagnosing and investigating health problems and health hazards in the community. Identifying and understanding the health issues and its source, basically. Social determinants of health, the conditions in the environment in which we born, live, learn, work, play, worship, commune, fellowship, etc., which affects quality of life and various health outcomes. Now we move on to the second core area, policy development. And so there are four So 3 through, we're having trouble with the math here, 3 through 6, 3, 4, 5, 6, 3 through 6. 3 through 6 is actually, they all fall under policy development. So informing, educate, and empowering people about health issues. This is public health promotion. Advocacy is in there too, but definitely public health promotion. This is raising awareness and using communications to make sure you're reaching the widest audience possible. And it's important because a lot of the issues when it comes to policies is because people don't have the information. They don't have the information because they don't have access. So this is really crucial. So public health promotion is really crucial to make sure that we can empower people about health issues. Number 4, strengthen, support, and mobilize community partnerships and action to identify and solve health problems. Advocacy and coalition building. Enough said. Number 5, develop policies and plans that support individual and community health efforts. And I'm going to actually include this with the first two, and this is why they're all included under policy development. We have to make sure that the policies and the policies and regulations and laws that are created actually are created in truth with the people in mind of who they're going to affect, right? They can't just be created in a vacuum and then when they're enacted, nobody really benefits, right? So they have to be something that supports the individual and the community. Then it's enforcing the laws and regulations that protect and ensure health and safety. Directing behaviors, right? Seatbelt laws, vaccine mandates. Those are examples. Number 7, linking people to needed personal health services and assure the provision of health care when otherwise unavailable. Increasing access to local health services. So when you think of things like rural health, people are living in areas where they don't necessarily have access to the doctor at the whim. It's not like urban areas where there's mass transportation. There are, things that we need in abundance many times. When you're in a rural area or a place where people are set further apart geographically, it's hard. So we have to make sure that there are pathways so that people can get the proper health care that they need. Number 8, assure competent public and personal health care workforce. Who are the providers and how are they serving the community? Are they competent? Are they giving comparable services that people who are in more affluent areas are giving, right? Because this is how we talk about balancing access and equity. So moving on to the third core service and the items under that, which are evaluating effectiveness, number 9, evaluating effectiveness, accessibility, and quality of personal and population-based health services. So this actually takes us back to why we monitor and record data based on the outcomes of results and corresponding interventions. We determine if the actions taken were not only relevant, but right. That's really key. And these are, our health outcomes that we're evaluating, both positive and negative, because it tells us which direction to go in. Research for new insights and innovative solutions to health problems. Sometimes methods get old and they have to be updated with the times. So this goes back to what I just said under the evaluating effectiveness. It's doing what is needed right now. This is even a form of, this is a form of righteousness. You can read Chief Yuya's book, The 14 Keys, and it talks about righteousness, doing what's needed right now. And that always needs to be what we do when we're talking about health. We have to be able to do what's needed right now so that we can have equitable services. And all of these areas, these 3 core areas, which encompass the 10 essential public health services, are coming together to ensure equitable access to healthcare. It's equity. Health equity is the absence of avoidable or remediable differences among groups of people, making sure people have the right amount of what they need. It's not the same as equality. It's what you need to make sure that you have access to the services to make sure that you have optimal health. So now on to the knowledge check. So question number 1, what is epidemiology? Do we remember? It's the study of the distribution and determinants of health-related states and events in specified populations. So if that's what you said, hopefully you're taking notes, you would be right. Question number 2. Health equity is the blank of avoidable or remediable differences among groups of people. So we just talked about this. So I'll give you a few seconds. 3, 2, 1. Absence. Health equity is the absence of avoidable or remediable differences among groups of people. True or false? There are 13 essential services in public health. This should be easy. False. There are 10. There are 3 core service areas, and there are 10 essential public health services. And those 10 essential public health services sit inside the 3 core areas. Number 4, what are assessment, policy development, and assurance? The 3 core functions of public health services. What are social determinants of health? Ready for the answer? Conditions in the environment in which we are born, live, learn, work, play, worship, commune, fellowship, etc., which affect quality of life and various health outcomes. So that is our lesson for today. Our previous course is our Introduction in History. So you should definitely go back and see how those connect to what we talked about today. And upcoming courses, we'll go a little deeper into public health communications, because that's that health promotion that's really important when we're talking about raising awareness so that people know and are informed, educated, and empowered about health issues. And then we'll go deeper into health equity. So you can contact me if you have questions. I can be reached at deidresully.com. My website is deidresully.com. I'm sorry, you can reach me at my Gmail, deidresully@gmail.com. And you can reach me on the website at deidresully.com. Subscribe to the True Health Live podcast. You'll hear a lot of what I'm talking about today will also be in the podcast. There's also a blog that has a lot of the information, and the notes for our class today, as well as the glossary, will be available also on the website. Make sure that when you go, you download the book, 10 Points in Public Health, Elements and Concepts, as everything that I'm talking about here is related. So thank you so much for joining, and we'll see you in the forward.